All right, let's dive into something I think we all know a little too well, even if we don't love talking about it. Mouth sores. You know those pesky things. Our listeners have sent in some great sources because, let's face it, we've all dealt with mouth sores, but how much do we really understand them? We're going to change that today, get into the hows, the whys, even what they might be telling us about our overall health, which I think is really interesting.
It's true, we often kind of brush them off as minor annoyances, but they really can be little windows into what's going on in our bodies.
Right, and that's what makes this deep dive so fascinating. So, where do we even begin? I guess with the ones we all know. Canker sores, cold sores, those are the ones we probably think of first, right?
Absolutely, those are the usual suspects. Canker sores or aphysis ulcers, if you want to get
Oh,
technical.
there's a tongue twister.
Right, they're those small, shallow little lesions, kind of a white or yellowish center with that red border, usually pop up on your tongue, inside the cheeks, gums.
Yeah, I've had them all those places, unfortunately.
And as uncomfortable as they are, good news is they usually clear up on their own within a week or two. No intervention needed, thankfully.
And they always seem to pop up at the worst times, like right before a big presentation or, a first date. Is there a reason for that?
Mm. It really does feel that way. It's like they know. While the exact cause is still a bit of a mystery, stress definitely seems to be a factor. Fatigue, too, and even certain foods can trigger them in some people.
Interesting. So it's less about a cure and more about knowing your triggers, figuring out how to manage those. Now, cold sores, those are a different beast altogether, aren't they? Those are caused by the herpes simplex virus, right? And here's something that always kind of freaked me out. I read that the virus can actually remain dormant in your body and then reactivate later on.
Yeah, that's right. Once you contract the herpes simplex virus, or HSV, it kind of sets up camp in your system, usually lying dormant in your nerve cells. But then something triggers it, stress rears its ugly head again, sun exposure, even just having a weakened immune system, and bam, you've got an outbreak of those fluid-filled blisters.
So even if you don't have an active cold sore, can you still pass the virus on?
That's the tricky part, and it's an important question. While it's less likely to be transmitted when it's dormant, it is still possible to spread HSV even if there are no visible sores.
Wow, that's definitely something to keep in mind, especially, in relationships. Close contact really emphasizes the importance of talking openly about any health concerns. Okay, so we've covered canker sores, cold sores, those are the more well-known ones, but there's another type I want to touch on, candidiasis.
Ah, yes, candidiasis, or oral thrush, as it's more commonly known. That was a fungal infection caused by an overgrowth of Candida yeast in the mouth.
Right, and this one I've mostly heard of in babies or people who are dentures.
Exactly. Those groups tend to be more susceptible to that overgrowth. But it's also worth noting that if you're dealing with persistent oral thrush, or if it keeps coming back, it could actually be a sign of an underlying health issue, like diabetes or a weakened immune system, something to keep an eye on.
So it's not just about treating the sore itself, but potentially looking deeper at what might be causing it, especially if it becomes a recurring thing.
Exactly. And that brings us to a really crucial point that we're going to dig into even more. Sometimes a mouth sore is more than just a sore. It can be a signal that your body's trying to tell you something else is going on.
It's kind of wild to think about, right? These little things we get in our mouths could be a sign of something bigger going on.
Absolutely. And that actually leads us to a couple of conditions that, while they might not seem like a big deal at first, can actually be early warning signs of more serious issues. We're talking about leukoplakia and erythroplakia.
Okay, those are definitely new ones for me. What are we dealing with there?
So leukoplakia, it shows up as these thickened white patches in your mouth. You might find them on your gums, your tongue, inside of your cheeks. And here's the thing, a lot of times they're painless. They might even come and go on their own.
So if they disappear, what's the concern?
Well, it's the potential. Those patches, as harmless as they may seem, they can actually indicate what we call precancerous changes in the cells of your mouth. It's thought that chronic irritation, think tobacco use, dentures that don't fit quite right, even biting the inside of your cheek a lot, can contribute to leukoplakia developing.
Wow, so something as simple as a white patch could be a sign of something more serious brewing.
Exactly. And that's why those regular dental checkups are so important. Your dentist, they're trained to spot those subtle changes, and they can recommend getting things checked out further if they need to.
Makes sense. Early detection is key, as they say. All right, so that's leukoplakia, and you mentioned erythroplakia along with it. I'm guessing they're connected somehow.
You're right. There are definitely similarities. Both of them involve changes in the lining of the mouth. But erythroplakia, instead of those white patches we talked about, it looks like red or velvety lesions. Now, these lesions are actually less common than leukoplakia, but they tend to be more often associated with precancerous or cancerous cells.
So just to be clear, anytime we're noticing persistent changes in our mouth, the color, the texture, even if it doesn't hurt, it's worth getting it checked out.
Absolutely. Think of your mouth as an early warning system for your overall health. It's sending you signals all the time, and it's really up to us to pay attention.
That's a great way to put it. It's like our bodies are trying to tell us something, we just need to know how to listen. And speaking of listening to our bodies, this one might come as a surprise, but what about celiac disease?
Celiac disease, you're thinking mouth sores, right?
Yeah, is there a connection? I always thought of that as more of a digestive issue.
It is. It is. Celiac disease is an autoimmune disorder, right? Your body basically mounts an immune response when you consume gluten, which ends up damaging the lining of your small intestine. But one of the symptoms of that intestinal damage that people don't always talk about, canker sores, they can be a real pain, literally.
I had no idea. So if someone's constantly battling canker sores and nothing seems to help, could that be a sign to explore celiac disease as a possibility?
It's definitely a conversation to have with your doctor, especially if other symptoms of celiac disease are present, like you said, digestive troubles or even nutrient deficiencies. Those can be signs. This connection really just goes to show you how interconnected our bodies are and how things we might think are totally unrelated could actually be coming from the same root cause.
It's fascinating. Okay, so we've gone from canker sores to celiac disease. What else is there? What about hand, foot, and mouth disease? That's another one I remember from back in the day. Babysitting, dealing with those blisters.
Yeah.
Not fun.
Oh, I can imagine. Definitely not fun. And while we usually think about it with little kids, adults can get it too.
Really?
Oh, yeah. Point is, those sores, even though they're usually mild and clear up on their own, they're part of a bigger picture, right? It's a viral infection.
So it's not just about the sores themselves. It's about understanding there's that underlying virus causing all the trouble.
Exactly. And understanding that underlying cause, that's the key to treating it effectively and figuring out how to prevent it in the first place.
Which I think brings us to the part everyone's been waiting for. How do we get rid of these things? Because as interesting as all of this is, let's be real, no one wants to deal with mouth sores any longer than they have to. So we've covered a lot of ground here, from the common culprits like canker sores all the way to some unexpected connections like celiac disease. But let's talk about what everyone wants to know. How do we tackle these pesky things?
Well, the good news is most mouth sores, they really do tend to clear up on their own. Give it a week or two, and you're usually in the clear.
Okay, but of course, no one wants to wait that long if they don't have to. So what can people do to find some relief? I'm always curious about those home remedies, the things you can find in your pantry, what actually works.
You know, sometimes the simplest solutions are the most effective, like a warm saltwater gargle. Honestly, it can work wonders.
Yeah, really.
Oh, yeah. It helps to cleanse the area, reduces inflammation, just a nice soothing effect.
It's so simple. I feel like we always forget about those simple things.
Right. We overthink it. Oh, and this one might surprise you. Milk of magnesia.
Wait, really? For your stomach?
Yep, same stuff. It can be super soothing for mouth sores.
How does that even work?
So it neutralizes the acids in your mouth, so it's less acidic, which helps it heal. Plus, it coats the sores, kind of acts as a protective barrier.
Oh, interesting. Like a liquid bandage almost.
Exactly.
Okay, that's a good one. Now, what about the drugstore? Any over-the-counter options that you recommend?
Definitely. You'll find a lot of gels and liquids that contain local anesthetics, things like benzocaine or lidocaine. Those can provide some temporary pain relief, especially if eating or drinking is uncomfortable.
Yeah, those numbing agents can be lifesavers when you need them. All right, so those are all great options for at-home relief, but at what point are we talking about a trip to the doctor or the dentist? When do those things just not cut it?
That's a great question. So if you're dealing with sores that just won't quit, or if they're super painful, especially if you've got other things going on like fever, definitely time to get professional opinion. They can help rule out any underlying conditions and offer stronger treatment options if you need them.
Always good to err on the side of caution. Now let's talk prevention. Is there anything people can do to reduce their chances of getting these things in the first place?
Absolutely. And a lot of it comes back to good overall health and hygiene.
So we're talking the basics. Brushing, flossing.
Exactly. Brushing twice a day, flossing daily. That helps to keep the bacteria in your mouth in check, which can definitely reduce your risk. Avoiding irritants like spicy foods, acidic fruits, that can make a difference. And if you're a cheek biter or a lip chewer, trying to break those habits.
It's amazing how those little habits can have such a big impact.
They really can. Oh, and this one probably goes without saying, but managing stress. Easier said than done, I know.
You're telling me.
Right. But stress weakens your immune system, makes you more susceptible to those outbreaks. So whatever helps you de-stress, even if it's just for a few minutes each day, it can make a world of difference.
I'm all about a little self-care, whatever it takes.
Me too.
All right, so as we wrap things up here, what's the key takeaway you want our listeners to walk away with when it comes to mouth sores?
I think the most important thing to remember is that sometimes those tiny little annoyances, they can actually be our body's way of telling us that something needs attention. Pay attention to what your body's telling you, and don't hesitate to reach out to a healthcare professional if you're concerned.
Such an important reminder. Listen to those whispers before they become shouts.
Exactly.
Well, deep divers, it looks like we've reached the end of another deep dive. We've explored the surprisingly complex world of mouth sores, from what causes them to how to treat them and everything in between. We even learned about some unexpected connections to our overall health, which I think is fascinating. Remember, knowledge is power. The more you understand your body, the better equipped you are to take care of it. So keep asking those questions, stay curious, and we'll catch you on our next deep dive into the world of health and wellness.